Thank you for joining us. This is Events Education. Today we'll be talking about a type of bacteria known as Listeria and how it causes an infection known as listeriosis. So let's get started. So it seems that every few months we hear Listeria outbreaks in the news, and these outbreaks usually lead to recalls of suspected foods that are usually contaminated. For example, let's watch this news report from early 2022.
The CDC is investigating a listeria outbreak in bagged salads linked to the deaths of 2 people. Dole is now recalling salads with best buy dates from November 20th to January 9th. The salads are being connected to 17 listeria cases. 13 people are in the hospital. The CDC says if you have these salads, throw them out and also clean any surfaces they were on.
So back in December 2021, there was an outbreak, a Listeria outbreak that affected packaged salads. There were a few deaths that were reported a few months later. A few months prior to that, there had been an outbreak of affected chicken, another outbreak that affected salads, previous outbreak that affected ham and pepperoni and other deli meats, and another outbreak that also affected soft cheeses. So as you can see from some of these headlines, Listeria outbreaks can be quite harmful, and sometimes they can even result in death. So what exactly is Listeria? Listeria is a type of bacteria that is found in soil, water, and farm animals such as cattle and poultry. Listeria infection is known as listeriosis. So listeriosis is a foodborne bacterial illness that can be very serious for people who are pregnant, the elderly, those who are over the age of 65, and people who have weakened immune systems. So typically, healthy people do not get serious illness from listeriosis, but it can be fatal in unborn babies, infants, and others who are immune compromised. So listeria is most commonly caused by eating improperly processed deli meats and pasteurized milk products or infected raw vegetables. So Listeria Monocytogenes is a gram-positive pathogenic bacterial species that causes listeriosis. So this bacteria is a facultative anaerobic bacteria, meaning it's capable of surviving in the presence or absence of oxygen, which makes it quite dangerous. Furthermore, Listeria monocytogenes can also survive in cold conditions such as refrigeration or freezing, which makes it a serious foodborne pathogen. So every year, approximately 1,600 people become ill from Listeria infection, and over 200 people die from listeriosis in the United States. So currently, listeriosis is the third leading cause of death among the foodborne pathogens, which exceeds the deaths that results from Salmonella or Clostridium infections. So sources of Listeria infection include contaminated raw vegetables, unpasteurized milk, and processed foods. This can include soft cheeses, hot dogs, and deli meats. So let's talk about listeriosis symptoms. So symptoms typically start showing 1 to 4 weeks after somebody has been exposed. So in pregnant women, symptoms can include a fever, fatigue, muscle aches, serious illness, or even death in the mothers or the newborns. Among the elderly or those who are immunocompromised, symptoms can also include fever. They can have muscle aches, they have headaches, stiff neck, confusion, loss of balance, and convulsions. Some of these symptoms among the elderly or immunocompromised are due to the bacterial infection crossing into the brain. We'll discuss that in a little bit. So let's now look under the microscope and see how Listeria infection moves within a cell and then how it spreads from one cell to the next.
This mammalian cell has been infected with pathogenic Listeria Monocytogenes. These bacteria move throughout the cytosol by recruiting host cell actin, which polymerizes and pushes them forward, producing a comet's tail in their wake. These bacteria can also form actin comet tails and move in cell extracts. Here, the bacteria are expressing the green fluorescent protein, and actin is labeled red with a fluorescent dye. Whenever a bacterium is pushed into the plasma membrane, it creates a temporary protrusion and is then bounced back to continue its random path. Occasionally, instead of being bounced back, the protruding cell membrane and the listeria within it are phagocytosed by another cell. When this occurs, the Listeria bacterium is able to break through both sets of cell membranes and enter the cytosol of its new host cell. Once in the cytosol, the Listeria is able to replicate rapidly. In this way, the bacterium can spread from cell to cell without ever entering the extracellular fluids, effectively hiding from the antibody response.
So we have seen how Listeria moves from cell to cell. Now let's take a step back and look at the bigger picture and see how Listeria infection moves from one organ to the next. So starting with the contaminated food when it's eaten and it reaches the intestines. From here, the Listeria infection moves from the intestines to the lymph nodes. From the lymph nodes, it crosses into the lymphatic circulatory system and ultimately it ends in the bloodstream. In the bloodstream, it can now move to various organs. For example, it can move to the liver or the spleen. The infection spreads and it can cross the blood-brain barrier and enter the brain, or it can also cross the placenta and impact the fetus. So how is listeriosis diagnosed? There is no routine test for screening one's risk for listeriosis. So in the clinic, listeriosis is typically diagnosed via bacterial cell culture. This means that a patient sample, the sample could be blood, their urine, spinal fluid, or placental fluid in case of a pregnant woman. That sample is collected and then cultured in a bacterial agar plates. So a positive test means that the colonies of Listeria Monocytogenes grew in the plates. So in that case, if there is a positive test, then that indicates that that patient has a Listeria infection. So how is listeriosis treated? So the treatment course for listeriosis varies, and it will depend on the severity of the disease and also of the patient. So patients who have mild symptoms typically do not require any treatment at all, especially if they are young and if they are healthy. Those who have serious Listeria infections are often treated with antibiotics. For example, pregnant women, antibiotic treatment may actually be necessary in order to prevent the infection from reaching the baby. However, even with treatment, sometimes death can still occur. So this is a serious illness. So how do we prevent Listeria infection? The first step is to wash your hands thoroughly with warm soapy water before and after handling food. Secondly, it's recommended to use hot soapy water to wash utensils, cutting boards, or any other surfaces where you prepare your foods. It's also recommended to clean raw vegetables with a scrub brush or a vegetable brush under plenty of running water. Finally, it's recommended to use a food thermometer to make sure that meats, poultry, or egg dishes are cooked to a safe temperature. And with this, we've come to the end of our talk for today. Listed here are some of the sources that we cited and what we use in preparing today's talk. We hope you learned a little bit about Listeria, how the infection happens, what bacteria causes it, why listeriosis is such a serious infection, and which populations are at high risk for this infection. We also hoped you learned how listeriosis is treated and how we can all prevent listeria infection. Please be sure to subscribe for more educational content. Thank you for your attention, and until next time, keep learning. Have a wonderful day. Thank you.